Good morning, and thank you for joining us today for the Council of UC Staff Assembly's Fall Quarter Staff Town Hall. My name is Jen Bowser, and I am Chair of CUCSA. I work at Santa Barbara, and I have 10 years of UC service. If you're not familiar with CUCSA, we are an assembly of volunteer staff dedicated to improving communications between UC administrators and staff. CUCSA's objective has been to provide service to the university by advising and providing a staff perspective to decision makers. Seen in this photo here, CUCSA consists of 2 delegates from each UC campus, Ag and Natural Resources, Berkeley Lab, and the Office of the President. We act in the interest of all staff, particularly non-represented staff or policy-covered staff, whose relationship with the university is governed by policy rather than collective bargaining agreements. Today, our town hall will feature Maynard Jenkins, Senior Director of Benefits Programs and Strategy. Open enrollment starts on October 31st, and in preparation for that, we will begin with a brief overview from Maynard about the changes to the UC benefits packages that you will see. The rest of our time will be spent on Q&A with Maynard, followed by a brief closing just before noon. We are recording this session and will post it to YouTube for those who are unable to join us today. The link to the recording will be posted on our website and sent via social media and our newsletter. To begin, let us acknowledge the land where we work, live, and play. The Council of UC Staff Assemblies, also known as CUCSA, recognizes that our service occurs on the unceded territory of the Indigenous peoples of California, and that these lands were and continue to be of great importance to them. Every member of our community has and continues to benefit from the use and stewardship of these lands. With respect and gratitude, we acknowledge and make visible our relationship to the original caretakers. Since our last quarterly town hall in July, myself and CUCSA Immediate Past Chair John Bodenschatz presented the CUCSA 23-24 year-end report to the regions. The link to the recorded presentation is being pasted in the chat for you to watch after you attend this town hall. And the 24-25 delegation met in person for the first time at UC Santa Cruz in September. For more information about this meeting, you can see the link to our meeting summary notes in the chat. And this year's work groups have been established, and the themes are a continuation of last year, with the exception of policy-covered staff identities, which is now staff engagement. You can read more about the work group charges in the document linked in the chat. I'll now pass this to CUCSA Chair-elect Desiree Hannon.
Thanks, Jen. Hello, everyone. Good morning. I'm Desiree Hannon, Chair-elect for CUCSA. I work on our San Diego campus. The Policy Covered Staff Identities Work Group highlighted one recommendation last year that was the intentional creation of opportunities for meaningful two-way communication between non-represented staff and leadership. This came out of the informal questionnaire that the work group conducted, which reflected how many of the non-represented staff they heard from expressed a sense that lines of communication between staff leaders across all levels were weaker than before the pandemic, and they felt less transparent and authentic. They felt improved communication would help build connection to their locations and to UC, and also help staff feel more seen and included. With that in mind, we have restructured our quarterly town halls to feature system-wide leaders. In response to this feedback, CUCSA is pleased to feature Maynard Jenkins, Senior Executive Director, Benefits, Programs, and Strategy, UCOP System-Wide Human Resources. Today, to highlight the 2025 open enrollment process and changes to this year's benefits and offerings. So please welcome Maynard Jenkins, a highly respected HR executive whose leadership has shaped comprehensive total reward strategies and transformed human resources functions across major healthcare organizations. We're thrilled to welcome him and his new role with the University of California and to have him share his insights today. Next slide. At the conclusion of Maynard's presentation, we will begin with selected questions that were submitted with your registrations. If you'd like to ask questions during the presentation, you can use the Q&A button in the Zoom. We will be monitoring that Q&A throughout the webinar, and a huge team of the benefits team will be in the background answering those questions, some of which we will likely answer live. And with all that being said, we will pass it on to Maynard. Take it away.
Thank you so much. And thanks to Jen and Desiree and CUCSA members for inviting me. As they've said, my name is Maynard Jenkins, and I only joined the University of California system in July over the benefits function. So I'm pleased to be here with all of you as part of the UC community and to get to know the CUCSA organization and to provide you some important information to prepare for this year's open enrollment. On the next slide, we have our agenda with some topics today that I'll preview of what you can expect for open enrollment this year. You may also have seen a preview story and email from Cheryl Lloyd, our system-wide Chief HR Officer. And I'll also cover some high-level medical plan updates for 2025 with more details that you'll all receive available on the open enrollment site late next week. And I'll also talk about employee contributions and other answers to questions that you pre-submitted before some of my teammates will join me for a panel Q&A hosted by Desiree toward the end of this discussion. But please feel free to type your questions into the Q&A and we'll try to answer them along the way. First, I would want to give you a high-level overview on the next slide of renewals generally. And I won't go into a lot of detail, but just after open enrollment, we start assessing your needs for plan coverage and medical benefits, as well as the performance of our plans for the next year. So we start as early as January, just having gotten through the open enrollment cycle. And we look at industry benchmarks and make choices to make the plans the best value for all of you as members and your families who are covered. This informs our budgets and premiums and the contribution levels for employees and faculty for the following year, which leads us to the open enrollment cycle, which we're in now. So let's talk a little bit about open enrollment on the next slide. This year, it begins, as you can see at the dates there on the slide and also at the bottom of each of our slides, on October 31st at 8 a.m. and closes on November 22nd at 5 p.m. University is offering the same benefits designs as 2024 with some just minor changes that I'll talk about. That includes medical, dental, and vision, legal, accident, critical illness, hospital indemnity, health and dependent care, FSAs, among other benefits. To continue sort of this preview on the next slide, the good news is that you do not need to do anything if you have no changes unless you're enrolled in FSAs. AD&D, pet insurance, supplemental life and disability are also available anytime, even beyond open enrollment. For the disability coverage and life, for example, you may have to show some evidence of insurability, but otherwise you don't have to wait for an open enrollment period to enroll. And you're automatically enrolled in experience identity theft protection, as well as adoption assistance. On the next slide, you'll also see that we've enhanced hospital indemnity, critical illness, accident, and legal coverages with no increase in premiums for employees and faculty. We do have some increases I will review for copays at the time of care in a few minutes, while full premiums for dental and vision plans remain fully covered by the University of California. So there is no contribution for those. On the next slide, we want to make sure that all of you have plenty of resources available during the open enrollment period. So we've made a resource available starting October 24th to support you. This is also augmented with website, and many of you know about the Alex AI Decision Support tool online. It's also supplemented with information resources and hard copy brochures that will arrive by mail. In addition, we plan many open enrollment events, both virtual and in person across our campuses, with all messaging reinforced by UC Path throughout the open enrollment period. Because you've submitted a number of questions in advance, I want to talk a minute about the contributions. We received a number of questions about this. We know that the cost of healthcare is increasingly more expensive, and I want to talk a bit about how we're balancing the university's contribution and budget compared to what we ask of faculty and staff who are covered by the plans. We are seeing cost increases again in 2025. This results from higher utilization, also higher care costs. So at the point of care, some of the, medications and other prescriptions are more expensive this year as well, in addition to medical care itself. The total premium is up to $3.71 billion, of which the university increase this year is $282 million more than 2024. So we worked with finance to increase the budgets to cover $198 million of this increase, so the majority of it going into 2025. To give you a little bit of context, I think it's on our next slide, overall, the university contributes more than 80% of the premium cost share for our medical plans. And to promote financial equity, especially for those in lower wage brackets, the university covers as much as 83 to 91% of the overall premium based on those salary levels. This does align well with external benchmarks because we always want to see how competitive we are and whether we'll be able to recruit and retain our staff, which shows a national average at 83% for single coverage and 71% for family coverage, compared to the university, which covers this at 85 and 81% respectively. So we're doing slightly better in terms of UC funding for the overall benefit package compared to the employee and faculty contributions, even though we know that this is significant and costs a lot of our employees and faculties. On the next slide, you'll notice that the pay bands will also increase with inflation. So, the 2024 bands have been reset by around $3,000 to $6,000, depending upon the pay band. And we also did our best as a team to limit contribution increases to single digits wherever possible. This resulted in a 9% increase for those who make under $140,000 in pay bands 1 and 2, essentially, and an 11% increase who make more in the 2 upper pay bands. On the next slide, one of the most significant changes we really want to call out, and we need CUCSA support to get the word out for members who are in the core PPO plan. As you may know, core has historically been a no-cost or free, high-deductible, catastrophic PPO plan. However, in 2025, core participants will also see a premium contribution with no design changes to their plan otherwise, but they'll have to start contributing instead of having it be a free plan through payroll deduction. We really want to make sure that those who choose core are aware of this change and actively assess their options to determine if core is still the right fit for them and their families. Just to reinforce this, there are targeted emails to core participants that will be sent out by the plan on or around October 31st, and more targeted emails coming from UC Path as well to the core participants to provide them more context for this important change. So please help us get the word out, because we don't want someone to not actively look at their options and then automatically enroll in core if they later find they didn't want to because of the new premium contributions. On the next slide, the good news is that other plan changes have been kept to a minimum. We are looking at increases in copays for office visits to $30 for the plans you see listed. Prescription drug copays will increase by $5 for a 30-day supply. And there is a new specialty drug tier at 30% of cost with a cap up to $150 per prescription. Some other changes that are coming, largely based on some regulations and other considerations. To comply with some of those regulations, the UC Health Savings Plan, or the plan we call HSP, members will be required to pay $30 per visit for virtual visits through Accolade Care. However, UC Care and core members can continue to access up to 12 free visits for virtual care for either primary and behavioral health separately, so 12 visits per each. Doula services will also now be free for up to 11 visits per pregnancy. And also, just as a note at the bottom, you can see that Kaiser Permanente will be expanding coverage into Monterey County in 2025. On the next slide, you can see that kind of the overall process we look at managing costs for future years includes both administrative costs and our claims costs. And in 2025, we will launch a benefits survey to all of you and the broader employee and faculty base to get your feedback on the benefits you value most, so that we can determine how we might make changes to our plans moving forward to make them both affordable in future years, as well as to make sure that we're offering what you and your families value most. With that said, I have a few team members who are here to take your questions along with me. Desiree is going to facilitate some live Q&A discussion for us, so we'll do our best to sort of be a virtual panel here, but also submit your questions online as well. And if we're not able to get to every question, we will work with Desiree and Jen to make sure you get the responses, as well as this deck after today's session.
Excellent. Thanks so much, Maynard. A lot of information there, and we have a lot of questions coming through. So the team is doing their best to answer your Q&A in the background there, so please be patient. First question we're queuing up is for Irene. What is the best way to get information about all medical plan options before making a choice during open enrollment?
Thanks, Desiree. Good morning, everybody. There are a lot of different avenues to get information about your medical plan benefits. As Maynard mentioned, starting next week, it'll be a week before open enrollment. On the 24th, the open enrollment website will be live at ucal.us/OE. The plan changes will be outlined there for all of our plans. From the OE site, there's also going to be a link to a brochure that we have. It's also an online comparison tool called Which Medical Plan is Right for You. That gives you plan features across all of our medical plans that you can compare and contrast. Also on October 24th, open enrollment brochures will go out with similar information. They'll be at your homes before open enrollment begins. We also have Alex, which is our virtual benefits counselor. It provides customized, personalized recommendations based on your salary band, covered dependents, your union, if you do belong to one. You even factor in your estimated utilization and different features like that to find out different plan comparisons. Each of our plan vendors will also have updated microsites that will have information about what's changing once open enrollment launches on October 31st. Each plan also has a document called an SBC, and that document is in a very standard format that's regulated by the federal government. And you can use that to also compare kind of a summary of all the different plans if you prefer to use that as well. And then last but not least, throughout the open enrollment period, many of our locations and campuses will be hosting in-person and or virtual open enrollment affairs where you can meet with our plan vendors, you can speak with other staff in the benefits departments to get more information about what's changing and how that may affect you and your family. So just keep an eye out for different announcements at your location.
Just a follow-up to that. So the open enrollment, the events, those are going to be the best options for people to dive a little bit deeper if they're looking for a little bit more personalization or kind of what should they choose, a counseling type of situation, I would assume. Yes.
Most of our vendors are not going to necessarily counsel
Okay.
necessarily counsel or give you advice on what to choose. But because we really want, basically we want them to give you the information and the facts that you can then use to figure out what's going to work for you the best. So they don't necessarily counsel, but if there's specific questions about things that you need to ask someone from the plan about maybe the pharmacy or maybe medications, things like that, in-person events would probably be good. The virtual events could also work, but we also don't recommend people talk about really personal items and things like that in those kinds of sessions. So we have a lot of different avenues for you to get information. There's also resources at your location. There's different benefit staff at your location who will be hosting, a number of events and things like that, or maybe even like drop-in sessions, throughout open enrollment where you can schedule 15, 30-minute sessions to speak with them one-on-one. So just look out for those types of announcements at your different campuses.
Excellent. Thank you.
Sure.
Next question is for you, Maynard. How is the university ensuring that its long-term benefit strategies remain a strong incentive for attracting and retaining top talent?
Oh, thank you, Desiree. This is a real critical question for us, and we're trying our best to balance. As you all know, the cost of healthcare increases, and I do feel good that as it relates to competition and what people could get through other employers, at least from benchmark perspective, we're performing well, a little over the national average for the amount the university covers of those premiums, but that doesn't really help us in terms of the overall costs, which keep going up. And so, as I mentioned, we're launching a benefits survey this year where we really want all of your feedback and from staff, faculty, and employees at large to help us understand, of the benefits package, what is most valued, where could we make changes that impact, value the least as it relates to the things you really want versus, perhaps coverages that, are less relevant to your needs. And so we're going to do our best to make changes for 2026 and beyond with an eye at balancing value with affordability to even see where we might be able to, bend the trend of increases and have, lower increases moving forward than the ones you've been seeing certainly in 2024. And you saw that we did our best to sort of smooth across all plans for 2025. But it really is a balancing act. We really do want to make sure that we're the employer of choice as the University of California. And we're always looking externally as well as internally to balance those needs in our future design. So you'll be hearing more from our team, but one big event you'll experience is really that survey. And please encourage, all of your CUCSA members as well as other employees and faculty to take that survey when you see it, because we're really going to use the results to inform our approach moving forward to really create the best value at the most affordable price.
Thank you. This question is queued up for Laura. How does UC ensure access to affordable quality healthcare for staff who work at locations that do not have UC health centers?
So UC really monitors the networks that we include in our plans with HealthNet and Anthem. We monitor them continuously to ensure that our members have access to providers that meet their needs. There are some areas, though, where it can be challenging, like Merced, where there just simply aren't enough providers in some specialties like behavioral health. And we're all doing the best we can to try to improve that situation. Another area that comes to mind, for example, is Santa Barbara, where there's a monopoly situation there with Sansom and Cottage being, Cottage is the only hospital and Sansom's basically the main provider physicians. So, but we do work on that continuously and try to make sure that we have the best we can for our people.
This question is queued up for Priscilla. My dentist left the Delta Dental network. What steps is UC taking to ensure access to in-network dental providers? And the Delta Dental is a hot topic, so lots of people have questions on that one.
Yeah, certainly, and appreciate the question. And we understand that this is very important to you all. I want to reassure you that my team and we do continue to partner with Delta Dental to ensure that their recruitment effort for new provider continues. We are monitoring on a regular basis with Delta Dental, looking at each county throughout California and making sure that there are indeed new providers available. We do see that Delta Dental are adding new providers on a regular basis. In 2023, they added over 1,350 new providers in California. So I do recommend that you check the Delta Dental website on a regular basis. They are doing that, and we'll continue to monitor for you as well.
Thank you. Next few questions are going to be queued up for Dan. Are UCLA health providers in network for all UC medical plans, and are there any exceptions?
Thanks for the question, Desiree, and good morning, everyone. These are great questions around our provider network for our different plans. So the question was specific to UCLA for the different plan offerings that we have. So first, for the UC PPO plans, which includes the UC Care Plan, the UC Health Savings Plan, and the Core Plan, UCLA health providers, and actually all of our UC providers, are included as in-network on those plans. The same is true for the UC Blue and Gold HMO. So UCLA Health and all of the UC providers that we have in our system are in network for Blue and Gold as well. Now for Kaiser, UC providers are not in network. This would include UCLA Health providers, unless you are taken to a UC in an emergency. Thanks, Desiree.
And I have one more for you. Where can I find out which providers are in a plan's network?
Well, again, another great question about our provider network. So everyone, I have a little show and tell for all of you if you haven't been to the UCNet website before. So UCNet was recently redesigned. So if you haven't been here before, this may look really new to you. So you can find a provider by first navigating to UCNet. It may look a little different on your screen. I'm using Firefox today. It may look a little different in Chrome or any other browser that you're using. But here's the homepage for UCNet. It's reminding you to vote. That's coming up. First, you can go in the upper right-hand corner and toggle to this menu bar right here, these 3 lines that you see. After you do that, there'll be several menu options that will come up. From there, you can click on Employee Benefits. It will then take you to this Employee Benefits landing page. Underneath the Health and Welfare section, you can see a variety of different benefit options that you can explore by going to UCNet. In order to find a provider, we're going to click on the medical plan option if we're trying to find a medical doctor. Once we click on that option, there will be several different plans that are available here. First, I want to call out that what we've been talking about today, including Alex, including finding out which medical plan is right for you, that's available on this landing page. But again, to specifically find a doctor, you can choose which plan you're looking for. So we have the core PPO plan, the Kaiser plan. Let's choose UC Blue and Gold. So you can either click on the text here or click on this arrow. You'll see some information right here on UC Blue and Gold. Again, there's more information about how the plan works. There was a question in chat earlier about how I can find out different information about the UC PPO plans. You can find out all of the information about UC PPO plans, the other options that we offer by clicking through UCNet. But again, to go back through how you can find a doctor, you will continue to scroll down on the page. Here's information about the premiums. We had some questions about that. You can see that there's this section right here that Irene mentioned earlier about the summary of benefits and coverage, also known as the SBC. That gives a rundown of the most popular benefits. But again, we're trying to find a doctor. So you can click right here on Doctor Directory. In each one of the plans, this doctor directly will take you directly to the vendor's website, whether it's Anthem, whether it's HealthNet, whether it's Kaiser, for you to find an in-network doctor or hospital in your area or where one of your family members lives. Thanks, Desiree.
Okay, and Priscilla, I have another one for you. Will spouses be added to the Experian Identity Theft Prevention Plan in the future?
Yeah, this is also a popular question I gotten since we implemented Experian April of this year. So I'm pleased that our UC leadership recognized that cybercrime is on the rise, and this new benefit, as I mentioned, was added April 1st of this year to help protect our employees and retirees. The intent of adding this, as you can imagine, there is a cost involved in adding. So at leadership, cost of benefits is important, to make sure we, maintain, that. And for this, at this moment, the coverage is for employees and retiree. I do want to share with you, and I think, I see some comments too, that, you can have spouse coverage for identity theft protection through ROG legal insurance. So for open enrollment, I do recommend that if you want your spouse to have this coverage, to check out the ROG legal insurance, and you can enroll your spouse to identity theft protection there.
Okay, so we have a few questions that came in the registration that it looks like are being duplicated over on our live Q&A. So I'm going to try to grab a couple of those. One of them that's come through is about long-term care insurance. Is that something that's being considered to be offered or something that we may be doing in the future? Has it been discussed? That's for anyone.
I can take that question. So that is something that we are looking at as well. And we are continuing to do the research. So, you know, and we have not completed our research yet, but it is something that we're looking at as well. So thanks for the question.
Another one that we've had quite a few questions come through is people trying to understand when coverage ends. Number one, for if they leave the university, how long does their coverage last past their end date? And then number two, whenever someone retires, how long do their benefits last before they have to switch to retiree benefits?
I can take that question. So typically, if you're leaving the university, you have benefits through the end of the month in which you terminate. For those who retire, you do get an extra month of coverage. So you get the current month that you retire and one more month of coverage.
Okay. Somebody asked this question and it's really interesting. Do husbands and wives have to select the same medical benefits? For example, an employee chooses an HMO, but a dependent would like a PPO. Can this be allowable? And if so, how would that work?
I can take that one too. So yes, the dependents must be enrolled in the same plan as the employee. And the employee is known as our primary subscriber. So you're the primary subscriber on the plan. So your dependents have to follow you on that plan. The only way to enroll in separate plans is if both spouses work for UC. And so if you're both UC employees, then you can enroll independently in your own plans. But if your spouse or partner is a dependent and not a UC employee, they would have to follow you in the plan that you enroll in.
Let's see. We have questions too regarding the additional coverage that's under some of the benefit plans as far as like physical therapy and chiropractic, acupuncture, things of those nature. Are there any changes to those additional items that are covered under existing plans?
I can take that one as well. So although our office visit outpatient copays are going up in most of our plans, chiropractic and acupuncture are the outliers. They are usually considered to be riders on our plan. And so what that really just basically means to you is that those copays are remaining the same. So for example, on UC Blue and Gold, the copay is going from $20 to $30. But the acupuncture and chiro will remain at $20. And then same for Kaiser, it'll remain at $15 for those as well. And then for UC Care, Tier 1, although the copay is changing for that plan, acupuncture and chiro are not in Tier 1, they're typically in Tier 2. So they remain at the same cost share as well.
I'm not sure how much detail we can go into this, but I'm sure that the audience is really interested in it. How does the university advocate on behalf of the staff in the negotiation part of our healthcare premiums? We know that we negotiate the money, then we decide how much money the university is putting in versus what the premiums are going to change. But what does that look like behind the scenes? Are there any insights that you can give as far as how much we're fighting for our staff and faculty?
Laura, I don't know if you want to take that on behalf of the team, just in terms of the kind of contract negotiation process in advance of rate setting.
Sure. Trying to think how to answer it. Yes, we do, is the short answer. Absolutely. You know, we want to keep the premium increases as low as possible, just as much as all of you do. The reality is, though, that a lot of what's driving the cost increases is about utilization in our plans. It's not so much unit cost. So it's not as much about a particular service costing more this year as compared to last year, or and so on. It's really more about our population is using more services, definitely more behavioral health, more kind of everything. We're seeing huge increases in the costs of our drugs. A lot of that's driven by things like the GLP-1 weight loss drugs for people who are non-diabetic. It's these things that are driving the cost of our healthcare, not as much about the negotiations of what we pay providers. So hopefully that adds a little insight.
And as far as pay bands go, we know that every year the pay bands adjust slightly, and typically they go up a little bit every year. How are those determined? And is there any thought on creating more than just the 4 pay bands?
Well, we try our best to track inflation as it relates to making adjustments in the pay bands. There has been some feedback that even having 4 is perhaps too complex. So we'll consider whether or not we need sort of more or less, because it sounds like some actually would rather have an additional pay band, where others feel like, having 4 is too many. But please, if you have feedback for us, either as part of this in the Q&A or, when you get the benefits survey, submit your suggestions and we'll try to take that into account. But right now we don't plan on making changes to the 4 bands, and we would continue to adjust them by, I'll call it inflation generally moving forward.
Excellent. This is a great question, and it's something that we've seen on the back end as well as in the Q&A. As far as submitting feedback, is there any mechanism for staff and faculty to give feedback on what plans are chosen, and kind of that process in general, or anything that's going to be added each year? Is there like a staff or faculty advisory group, or what mechanisms can staff use for feedback for items?
We have benefits managers and healthcare facilitators across the campuses, and we meet with them regularly to process feedback that you have either locally. And then we have engagements, like this one with CUCSA around open enrollment. We meet with a number of different constituent groups, among them university, to really try to gather feedback just in time. You could always reach out to your benefits professional directly, as as you have a question or need support or have suggestions. And then, of course, as I mentioned, we'll do a benefits survey, which doesn't happen every year. It's something we really want to take a wholesale look and do an assessment and gather broad feedback and really make sure that future designs meet your needs. So we have a number of channels to provide feedback, and there's not a wrong one. Call the benefits leader or professional that you know, and we'll do our best to incorporate your interests into our future plans.
Great. And that's a really important point, that we know that there are several system-wide surveys that are going to be happening in the next year or so. And there was a request for proposals, and vendor has been chosen for those. So one of those is that benefit survey, to make sure that we are offering the best benefits to our staff and what they need. So I'm looking forward to that. That'll be an excellent feedback mechanism, I think. I did have a specific question around Kaiser. It looks like Kaiser is expanding into Monterey County. How would they know exactly, those people in those areas, what zip codes are included in that?
We received a pretty lengthy, and I think there was a response that was put in there. I haven't validated those zip codes, but I'm sure that Garen is correct in the zip codes that he listed. But all of Monterey County, all employees that reside in Monterey County are going to be sent a postcard that's co-branded with Kaiser, just announcing the opening of their new Salinas medical offices. So people that live in those zip codes will receive that information, just so they're aware of the expansion.
As far as timing, when we see these increases in our premium charges, we know that the increases, we've seen a lot of people saying we got a certain percentage increase in our income, and then the benefits took all that away. Can you explain the timing a little bit of when those premium costs are determined, and how that aligns with when it's determined what increase is happening for income, for compensation? I'm guessing it's around the same time, so it's hard to plan to make sure that those percentages match or come out to an employee benefit.
So I
Is
know
that a stumble?
the increases will be effective, starting in January. And typically this increase, is, even though the percentage may be 9% on a smaller base, it typically, may not be as much as a wage increase. But I'll have to ask the team to help me on the normal cycle for wage increases and the timing for that compared to January 1st for the benefit contribution increases.
It's July 1st typically for salary, because that's the beginning of our fiscal year.
And typically, I'm guessing that the negotiations for the new premiums are happening at the exact same time, so we wouldn't be able to specifically know what each percentage is going to be.
It has not been established by July 1st, what exactly what our premiums are going to be, and then what employee contributions will be.
Right. I think it's important to remember too, that just because you're seeing a 9% increase in your premium, that's a much smaller number than your actual income, which is a much larger number, and then a percentage on that. So you have to play the percentage numbers. A 9, it's not apples to apples, I guess we would say, right? It's not a 9% to 4% exactly.
Good point, yes.
Yes. Let's see, what other questions? There's lots and lots of questions, of course, around Delta Dental. So does anyone want to weigh in any more on that? It looks like one of the biggest things that people are being upset about is that their current dentist that they've been with for many, many years is now no longer accepting Delta Dental. Is there a way to work around that? Is there like a reimbursement program through Delta Dental that you could still go to your same dentist and then put claims to the insurance to get reimbursed?
Our PPO plan, so we have two dental plans, right? We have our PPO as well as our DHMO plan, Delta Care. For the PPO plan, there is the option to utilize out-of-network providers, and you do get coverage for that. So if your dentist does leave the network, no longer with Delta Dental, then it can be reimbursed through the out-of-network coverage as well. So the one thing I will share and our understanding, I think coming out of the pandemic, it really had an impact on some of the contracts that Delta Dental had with their providers. They were seeing an uptick of, some dentists that are decided to retire. Some of them closed their practice. Some of them, decided to not contract with any insurance. So there was a change in the industry coming out of the pandemic. And we do recognize that, and Delta Dental also recognized that. So they did implement a program to welcome back any providers that were at work, and continue to connect with them to make sure that, stay connected with them and welcome them back if they should join again. So those things were put in place. Yeah.
And I did see, it looks like Heather, you had marked a question that you would want to answer live. UC premium rates are going up dramatically, as we know, since one of the most expensive healthcare providers and hospital systems in our state is our own UC health system. How are we really working to address the fact that rising prices in one major part of our dramatic increases in our health benefits program? So huge, and they did say caveat, huge props to UCOP for contributing more. As we saw, it was nearly a 200 million, I think, increase for employer contributions, but we assume that that's not sustainable.
That question would be for our medical plans team, probably Laura's team.
Desiree, do you want to restate it? I know
Yeah,
Dan
I'm trying to find the
I can
question.
reread it.
All right, it was a long question.
I also know Dan had a
I'll leave
follow-up,
the
so I
props
don't know,
part.
Dan, if you could cover both. But Desiree, why don't you start by restating the question?
Yeah. So UC's premium rates are going up dramatically since one of the most expensive healthcare providers in the state is our own UC health system. How are we as a health system, I think is the question, really working to address the fact that rising prices is a major part that's contributing to our premium increases. Is our own health system addressing that issue as far as cost? I think that's the question.
Okay, I'll take a stab and then maybe other people can chime in if they want. So we do negotiate with our own health system and are trying to work even more closely with them on determining how much that we'll pay them and make that more affordable to employees. However, I'll say again what I said earlier, which is a lot of what's driving the cost is not these unit cost increases. It's not what we pay ourselves. And I should also point out that historically, our increases year over year for our own health system have been lower than by a lot than medical inflation, what they're getting from other health plans in terms of year over year increases. But as I said earlier, a lot of the cost is not what's driving the increases in cost is not that year over year increase. It's about utilization and about drugs.
And let me ask Dan, I think you had a follow-up on the UCLA question from earlier.
Thanks, Maynard. Sorry, team. I have a follow-up to that original submitted question about whether or not UCLA providers are in network. I didn't refer to all of my notes, so I apologize. So I did say that UC doctors under the Blue and Gold plan are all considered to be in network. This is true for almost every geography inside of California, except for Santa Barbara. So team, if you've been following the chat, we do have a pocket of UCLA doctors in Santa Barbara under the Blue and Gold plan. Unfortunately, they don't have admitting privileges to Cottage Hospital, the local hospital in Santa Barbara. As a result of that, they cannot be considered in network under the Blue and Gold plan. That's a DMHC, a California DMHC requirement. So that is why they are not considered to be in network under that plan. So those UC providers in Santa Barbara for Blue and Gold would not be in network. But for the remainder of the geographies, UCLA, if you're around there, all of those UC providers would be considered in network under the Blue and Gold plan. Thanks for letting me clarify that. And thanks to everyone in the chat that pointed that out.
Yeah, thanks for catching up. And then this one was marked to answer live as well. And it was something that came up in a meeting actually that I was in yesterday too. UC is an employer, a healthcare provider, and an insurer for most of our colleagues. Is there any work being done to innovate how we leverage having all of these roles within our organization to provide lower service costs? As in what somebody had asked me yesterday was, if we decide to use the UC system, can we then give an incentive to people to actually get healthcare within our own system as staff and faculty?
We're doing our best to balance that. And I think we do have an advantage to really see all sides of the business, although we also play respective roles. So as health plan administrators on your behalf, we're really fiduciaries, with your funds and our funds together to make our plans as affordable as possible. And in some ways that creates some dynamic tension, where we're really trying to drive costs down while the university health system, UC Health, is really trying to make sure that they have enough margin for the services they provide. But we can learn from each other and really use our understanding of each other's roles to inform innovation. And that's really why I'm excited to join at this time as we really look forward. I know our plans have been fairly consistent in terms of the offerings over a decade. And so we really do want to look toward 2026 and beyond for some updates that are more contemporary, more innovative, and especially to the extent possible, affordable options looking forward. So again, we'll learn from each other to inform those future designs. And there is an advantage to having all sort of roles within one organization compared to the average employer that has a limited view of opportunities in this regard.
Excellent. And we only have a few minutes left. So can we offer our audience a timeline of when the new medical plan costs will be posted. I think that was in one of the slides, but it was asked again, so I want to make sure they know when all that info is coming out very soon, I think.
October 24th is when the open enrollment site will be launched. So that's the full week before open enrollment begins. So you'll have access to that for pretty much a full month until OE closes. But that's when everything will be live.
Okay. And when that goes live, that'll also be integrated into the ALEX system where people can estimate what their costs would be, figure out what insurance plan would be best for them. All that stuff will be integrated into that, correct?
That's correct.
Perfect. Okay. And with that, I think we've gone very close to the end of our town hall here. Thank you all so much, the benefits team and Maynard, for being with us. I feel like you've answered a ton of questions. There were so many more in the Q&A, and I apologize to the audience if we can't get to all of them. There was just a lot of questions. But as we recommended earlier, definitely look for those open enrollment events. Reach out to vendors if you want information from them. And then your local benefits office is going to be a huge help as far as one-on-one counseling and helping you decide on what works best for you. So definitely reach out to your benefits people at your individual locations. It's a great place to go. And then I'm going to pass it on to Jen for our closing. Jen, take it away.
Thanks, Desiree. Our next CUCSA Town Hall will be in January and is going to feature UC President Michael Drake. So stay tuned for when the exact date is going to be. That announcement hopefully should be coming out soon. And I just want to thank Maynard and his team for your presentation today and addressing the community's questions about 2025 open enrollment. And thank you to all of you, our audience, for attending today's town hall. The video recording will be posted to CUCSA's website shortly, and many of you have asked what will also be posted. It will be the slide deck, and we're planning to put together an FAQ. As Desiree noted, we didn't get to all of the questions, so we hope to do that and also follow up with any questions that may not be directly related to today's webinar. For you to stay connected with CUCSA, you can follow us on social media, subscribe to our newsletter, and you can access our YouTube channel and more by visiting our link tree, and we have the website here. And until next time, I hope everyone stays well and take care. Thanks again for joining. Have a great day.